Hello, I'm Leslie Lee from Aesthetic Creator, and today we're going to talk about chemical peels. So chemical peels is something that is, I would say, one of those things that patients kind of freak out about because they're like, am I going to look like, fluffy? Am I going to look like, just terrible? And the answer could be yes, but also no. So it kind of depends on the peel that you're doing. Like what level are you doing? Are you doing a light peel or are you doing a deep peel? Because there's absolutely some peels that can make you look quite nice for a few days. So typically for me, like what I do is I do like the aggressive peels. I really prefer the VI peels, which you can actually do on the same day as your toxin, which I really appreciate. But 3 years ago is kind of when I really started to get into the chemical peels. They've always been, something that have been in my back pocket, but not something maybe like personally that I would say, oh my gosh, yes, I love them. But they are now. So before I was like, they do what they do and no big deal. Yep, they turn your skin over, but you should really be doing a laser or you should really be doing something else. But what I found is that the peels actually help you just look brighter. So our daughter got married 2.5 years ago, and 10 days before her wedding, I did a chemical peel. And I had done one prior, so I kind of knew what to expect, but I was like, it was so close. And a lot of people come in and they're like, what do I do? I'm a mom of the bride. I'm doing this, I'm doing that, or I have this big event coming up and I don't have time to do the fillers and the Botox and the this or all the things. Because, we're creatures and we get busy and we just decide like we're gonna put it off and then all of a sudden it's too late. So if you have something coming up or you're just like, I just want to start to prep my skin, I'm not into doing, Botox, I'm not into doing fillers, I'm not into doing kind of anything that's, a laser or microneedling, a chemical peel is fantastic. So it will help refresh your tissue. So it basically turns your skin over. It will help with brown spots, it'll help with acne, it can help with red spots, just the texture, tone, and crepiness, again, with your tissues. I would say it can somewhat help with pore sizes. If you really have a pore size issue, maybe I would do more microneedling. But if you're like, I just need something for my face. And the great thing about peels is you can do them all year long. Like I'm not gonna tell you to do a peel and then go sit in the sun, but you technically can do a peel in the summer and you'll be totally fine. So a lot of my girlfriends, that have daughters getting married or different things, I'm like, go do a chemical peel. It's fantastic. Your downtime's not that bad, at least in my opinion. So usually what will happen is you'll come in, we'll cleanse your face, we'll alcohol it off, and we'll do a prep. So we use a fan for that because it's kind of like fumes in your face. And then we put the peel on, you leave, and then 4 hours later you rinse the peel off, and then there's a whole protocol that goes along with it. So about day 3 to day 5 is kind of when you're gonna get that peeling effect. And I've done plenty of peels in my life, and I think I've had like one time where my son, who notices literally everything, looked at me and he's like, what's wrong with your forehead? And I was like, I'm just like flaking off, like, you're not supposed to peel it off, but it's tempting. So, but for the most part, it's kind of just like a nice, flake. And your skin does somewhat come off in sheets in some areas of your face, but I think it's not as what people think of like, oh my gosh, my whole face is just gonna peel at one time. It's more, I would say that day 3 to 5 is kind of those days where you're like, oh my goodness. So I always say like, make sure you're changing your pillowcase after your peels because you're shedding tissue and you're not gonna see that dead tissue necessarily on your pillowcase. So just making sure that you're changing that. But then about day 8, so I used to say day 7, but I've had a few patients who are like, day 7, I feel like I'm still, flaking. So that 8 to 10 day, your skin looks fantastic. It's brighter, you're more glowy, all of the things. So I think it's just a really nice treatment to be able to come in for a pick-me-up. And if you do a toxin with it, literally 2 weeks later, your face is like kind of transformed, in my opinion. You look in the mirror and you're like, oh my gosh, my lines are gone, my skin looks great, like I just look great. So I think peels you can use them kind of for everyone, I think, but I think it's really important, again, to know who we're treating and why. So maybe somebody that's, in their 60s, 70s might benefit from a peel just from a standpoint of like they look dull, we're gonna help their skin turnover, they're just gonna look a little bit brighter. Somebody who's maybe a little bit younger is gonna get more of a result. And so I think it matters, age range. Again, when we're treating in aesthetics, we're not just treating like the patient, we're treating their age, we're treating their preferences, we're treating kind of like their overall intention of what they're doing. And so it's really important to kind of take all of that into consideration, but peels are really, really great just to kind of give you that pick-me-up, that glow, all of the things. And so I think they're nothing to be scared of. They're kind of, again, that gateway into the aesthetic world of like, I want to do something for myself, but I don't want to do something that's super aggressive. We can, titrate different peels for different results. You can get a peel where you just kind of have no downtime at all, and you can get a peel where you're going to have, 3 to 5 days of downtime. So it really just depends on what we're picking. So again, when we're looking at the skin, we want to do things that are going to regenerate it, make it look nicer, give you that realistic amount of downtime. A lot of times patients are like, I don't have 2 weeks. Well, you don't need 2 weeks for a peel. Not all peels, maybe some. The ones that we, use, you don't necessarily need that. But I think it's really important, again, to talk to your provider. What peel are they using? What is the downtime? What are the effects of it, right? Because there's different peels have different products in them, and they're very specific to what they're treating. Like we might do a peel specifically just for acne, and it will help clear up the acne, but then we also might do a peel that has the hydroquinone in it and different things to kind of help with the pigmentation. So I think that that's important again. So again, at Aesthetic Creator, we are just trying to do everything with intention and helping you age gracefully and how you feel like is gonna make you look like your best self.